7 months to 8 months. Gross motor, sub-skill, turns the body and freely plays with the toy while in a sitting position, sits stably. 2. Rattle. Test and judgment criteria. 1. Put the child in a sitting position. 2. The examiner places the rattle beside the child's hip. Pass. The child is able to turn to get the rattle and then returns to face forward while still sitting. Gross motor, sub-skill, stands by holding on to furniture at chest height. 2. Rattle, loud sound. Test and judgment criteria. 1. The examiner puts the rattle on an item of furniture such as a table or chair. 2. Place the child in a standing position, holding on to the furniture at chest height. 3. The examiner encourages the child to look at the rattle. Pass. The child is able to stand for at least 10 seconds by using his or her hands to support the body and can shift his or her legs. Fine motor, sub-skill, looks at a book with an adult for 2 or 3 seconds. 2. A book with large, colorful pictures. Test and judgment criteria. Sit the child on the parent's lap. Open the book and talk to the child about a picture. Pass. The child looks at the picture in the book for at least 2 to 3 seconds while the parent is talking about the picture. Receptive language, sub-skill, response to name being called. Test and judgment criteria. Let the child play freely. The examiner calls the child's name at normal volume, 120 centimeters from the child. Pass. The child turns towards the examiner. Expressive language, sub-skill, imitates conversational sounds. Test and judgment criteria. Observe if the child imitates conversational sounds within the assessment, or ask the parents for information. Pass. The child can imitate different conversational sounds, at least 2 sounds. For example, da, ma, pa, da, u. Personal and social. Sub-skill, plays peekaboo. 2. A piece of 30 by 30 centimeter cloth with a half centimeter hole in the middle. Test and judgment criteria. 1. Ask the child to look at the examiner. 2. The examiner covers his or her face with the cloth. 3. The examiner reviews half of his or her face and says, "Peekaboo," and then hides his or her face behind the cloth. Repeat again, showing the face from the same side of the cloth. Then the examiner says, "Peekaboo," without showing the face, and looks through the cloth hole to see whether the child looks where the face was shown before. Pass. The child looks where the face was shown, or hides his or her face to play peekaboo with the examiner. Objective: to strengthen the relationship between the child and parent or caregiver.